Good afternoon. My name is Sheree Hall, and this is a video demonstration for Partial Fulfillment, Teaching Strategies and Theories, the University of Texas Arlington College of Nursing for a master's program. This demonstration today will be presenting a problem-based learning using a simulation model. My reference group for this is experienced postpartum nurses. Utilizing this mannequin, the staff will be presented with a case study, so they will demonstrate the strategy of problem-based learning. The objectives for this session will be that the participants will identify and list the causes of postpartum hemorrhage, and that participants will demonstrate the steps to identify postpartum hemorrhage based on the specific case study that will be presented to them. My reference group. Hi Sharon, how are you doing today?
Yes.
Alright, so as you know, we do these drills periodically just to make sure that our competencies are up there. So today we're going to run through a simulation drill with your postpartum patient. Let me give you some background on the patient real quick. This is Miss Mary. Miss Mary just delivered. We received her about an hour ago. She's a gravida 5, para of 4, 39 weeks gestation, who just gave birth to a 9-pound, 10-ounce baby. Her labor was induced for Pitocin for social reasons. Because her mother was in town to take care of her other 4 children. Pitocin was started at 5 o'clock this morning. At about 3 p.m. this afternoon, she did request an epidural at 5 centimeters. Pitocin was continued, and the patient wound up being complete at 7 p.m. And after 2 hours of pushing, she delivered vaginally with a midline episiotomy with a 3rd-degree extension. Her estimated blood loss was 750 mils. She is planning to breastfeed, but she's not been successful with her other children in breastfeeding. And her last delivery was just 13 months ago. So based on this case study, tell me what would be some of the risk factors or some of the causes that this patient has for postpartum hemorrhage.
Well, she's a multip.
Okay.
Been pregnant 5 times. Her last baby was 13 months old. That's very quick. Short span in between. She received Pitocin during her labor for a long period of time. She had a large blood loss at delivery. 750 is a lot for a vaginal delivery.
Mm-hmm.
Okay.
Good. All right, that's great. So now I want to continue with the scenario. Now it's been about an hour since you've received the patient here in postpartum. She is experiencing some skin-to-skin time. We're trying to encourage that bonding and some breastfeeding. So the patient starts to tell you she feels lightheaded. She's a little bit nauseous. Asks you to take the baby. So you take the baby off her chest, which we've already done.
Okay.
And the baby does, or mom does at that time, vomit. And you notice that she appears to have maybe passed out.
Okay.
What would your immediate actions be at this time?
First of all, I would call for help.
Okay, so we called for help.
Called for help. She just passed out after saying she was she vomited, and this was like her 5th baby.
Okay.
So then I'm going to put her head down, and would you hand me some gloves, yes, please? And I'm going to check the bleeding. Thank you. And will you open up her IV?
Yep. What is the state of responsiveness of our patient right now?
She's unresponsive.
She's
Mary,
a little bit there. She's kind of with you a little bit.
So we can put some O's on her.
All right.
And we're going to call for the patient care tech, and she's going to do vitals and put an O2 sat on her. See how that's going.
Great. It's great that you all demonstrating teamwork.
Mary, can you hear me?
So at this point in time, based on the data that you've received earlier and on this patient's presentation, what do you think is going on? What are the assessment things you're going to be looking for?
Clots, bleeding, bladder. Yeah, because they didn't tell me when she voided last. So, and by massaging, I should be able to feel the bladder. If not, we're going to go ahead and put a catheter in.
Okay.
And that way, if she continues to bleed, the bladder will be out of the way, and we can massage a lot better. If she doesn't have Pitocin in her IV, we definitely would put Pitocin in. I would send the nurse out to call her physician and let the physician know what's going on with the patient and get orders for IM medicine, IV medicine, and for him to come and evaluate it, it continues.
Okay. If the patient state continues to deteriorate before you can get
Yeah.
the physician here, what will be your response?
We would call a rapid response, and
Okay,
that
great.
would bring a team of nurses in to help us evaluate her and get her to wherever she needs to be, whether it's to the OR to see if there's retained placenta, or to ICU, start the blood. They're there, extra people.
Great. Great job. All right. I appreciate your help. What I want to go over with right now is just a little bit of feedback. Let's
Okay.
talk a little bit about just kind of recapping this scenario.
Okay.
Wendy, what else would you want to add to this specific scenario? Anything that we would reflect on that maybe we would do differently, or maybe in addition to, or did we do everything just perfect? Or your hindsight's always 20/20, so it's a good learning.
I think everything was good, except I would call rapid response a little bit sooner, just so that they were here. Even if they're here and standing in the hallway, at least they're already here, that team is already here, because that rapid response team is gonna be the same as the code team. So that if she does deteriorate and she's got such a big blood loss volume that she starts going into some funky heart rhythm, that they're already here and they can evaluate that heart rhythm and do an EKG and get her out of here if we need to send her to ICU or the OR, like Sharon said.
Sharon, anything else?
I probably would have had someone starting another IV, so we have two
Yeah, second
access.
line.
Great.
And really start putting the fluids in.
Right, I was just going to ask you, why would we need to do another IV site to do?
One for blood, one for.
Yeah, that second line, we would start probably normal saline going.
Okay, great. Well, I appreciate y'all's participation in this. Great feedback.
Great.
Good teamwork. Thank you.
Thank you.